Okay, last question. About excess skin. That's the biggest fear of mini gastric bypass surgeries. I mean, I think I watched over 100 videos before I came, and most people were all worried about that. Most people had that. But then I think it also comes back to what I've heard since I came here about the age when you do it, because maybe most of them were older people and the skin didn't have that much elasticity, and that has been my biggest fear. So if I lose a certain amount of weight, does that mean I'm going to have to start coming back to have another surgery to remove the skin? I mean, it seems like the beginning of an ending journey of surgeries, so...
See, on one hand, we want to lose weight. How much you want to lose? You want to be perfect or just okay?
I've never been a fan of skinny people, so
okay.
no, I think.
Then you selected a wrong surgery, I suppose.
But I don't want to be skinny. I still like the flesh. I just want to be healthier.
Yes.
If that makes any sense. And the UK size, I think a size 12 sounds just about fine. I don't want to be an 8. No.
See, we cannot be so perfect. I mean, God has not marked the intestine, so I don't know. In your case, I have tried my best as per my experience to give you an undercorrection. Okay. So we always fear MGB. It's like a machine gun, very strong procedure. So you have some chances of becoming, too thin. So that's why always I'm a little bit conservative. Little bit more conservative than Dr. Rutledge.
No, I'm more aggressive.
I think your patients in the US, they eat much. And here, in our Indian patients, I have seen there's a difference in patients, which area you're coming from. If my patient is coming from Gujarat, I give them a 4-feet bypass. If the patient is coming from Punjab, I give them 6 feet. Then US, 7 feet. And maybe for you, a little bit 1 feet more. Because you can take chicken morning, evening, afternoon. So it depends how much proteins you can take. And about the skin loss thing, Dr. Rutledge, what do you want to say about the sagging skin?
Well, I think that first of all, that we would like perfection. What we wish is that we were magicians and you would come in with a picture of Beyonce and we would say, okay, we'll give you that. As you know, we cannot do that. But there are some good news and some bad news. One is, the good news is you're young, and exactly like you said, you are very educated on this, and you're quite correct. You have much more elastic and healthy skin than somebody who's 70.
Right.
The other thing is we have different levels of obesity in patients. Some who suffer from such terrible obesity that the weight loss will result in wrinkled, saggy skin. And so it's hard to predict from person to person, but the best predictor is your age. And so it's very likely that you won't have a lot of extra skin. And then your decision on to whether or not you want to do plastic surgery is a cosmetic decision. You don't have to do anything. Some people with even massive weight loss will just keep it under their clothes, and that's that. Some people are very excited about going to the beach. Requires plastic surgery. I certainly wouldn't want to be in a bikini and
be very thin.
I'm not sure why I said that.
It happens sometimes, Some things come out spontaneously. Any other question in your mind?
Even a thin, I'd like to finish that. Even a thin person can require plastic surgery to look good without clothes on. So again, most of our patients say with massive weight loss, they can look very attractive in clothing. And when you start asking, can I really become a fashion model, that's asking a lot.
What if one wants to look good?
Well, that's option, but again, that's when you start to talk about the plastic surgery. There's nothing wrong with that, but we have seen tremendous impact on people's lives when they look different. And if you like, I can comment on that, but the looks change lives.
Yay.
Any other thing?
No.